Hi, my name is Jared Gollob. I'm Chief Medical Officer at Kymera Therapeutics. Well, so for a disease like atopic dermatitis, one of the, greatest sort of achievements from a treatment standpoint over the past decade has been the introduction of dupilumab, which is a monoclonal antibody that is targeting and blocking the IL-4 receptor alpha, which is the key receptor for both IL-4 and IL-13 signaling. And so this drug, which is given as an injection, every 2 weeks in atopic dermatitis, has been very effective because it's able to fully block, both of these pathways, IL-4 and IL-13, which are driving the signs and symptoms of the disease. However, this is an injection, and injections are not easy for either adults or children. So having a drug, an oral drug that could do something similar to dupilumab has been sort of a holy grail, if you will, in the atopic dermatitis field. STAT6 is an important signaling protein. It's a transcription factor which is absolutely required to signal through the IL-4 and IL-13 receptors. It sits within the cell, not outside the cell like the receptors. And so our STAT6 degrader is an oral drug that is able to specifically target STAT6 within the cell to be able to degrade and essentially get rid of STAT6. And by doing so, it's able to shut down the IL-4, IL-13 pathway to the same extent as an injected monoclonal antibody, but now it can be done with an oral drug that's given once a day. And so what's important about our drug, KT-621, and what we've shown in this phase 1b study in atopic dermatitis is that it appears as though by fully degrading STAT6 with relatively low doses of this drug given once a day, we can block the pathway, reduce these inflammatory biomarkers, and result in effects on itch and on skin lesion burden, which appear to be comparable to what has been seen previously with dupilumab, in the same time frame. On this study, we treated for only 4 weeks with our drug, which is given daily. Typically, you treat, for 16 weeks on larger, more pivotal clinical trials, but you can often see effects of these drugs within 4 weeks. Dupilumab has seen that. We've seen it now with our drug. And for our drug to show a similar effect to dupilumab, in this 4 week period, understanding that this is a cross-study comparison. We didn't do a head-to-head comparison with dupilumab. We're looking at our results and comparing it to published results with dupilumab. But what it seems to be showing is that, targeting STAT6 in this unique way with an oral drug can potentially give activity that could be comparable to the injectable dupilumab. So IL-31 is produced, through the activation of the IL-4 and IL-13 receptors. So one of the downstream effects of activating those receptors is for cells to produce IL-31. And IL-31 is a key cytokine that causes itch. So it's called a pruritogenic cytokine. There really hasn't been any published demonstration of changes in IL-31 in the blood using dupilumab, but we were very interested in looking at it in our study. And we were able to show that after 4 weeks of treatment with KT-621, our STAT6 degrader, we were able to see an average 54% reduction of IL-31 in the blood, which really went along with the profound effects that we saw in reducing itch over that 4 week period with our drug. So for us, it was a nice way to connect, the impact of our drug on a biomarker, IL-31, which is known to drive itch, and to connect that with the actual impact of our drug on the symptom, on itch itself in these patients. And this is the first known demonstration of IL-31 reduction, by a drug that is targeting the IL-4, IL-13 pathway in atopic dermatitis.